Oh, hi. Didn't see you there. Ham. Hi, my name is Karen Jorgensen, and I'm talking to you from just outside Tucson, Arizona. And I want to tell you about my experience with the Egoscue method and with Deb Preachuk. This take an extra minute because I'm not brand new to the concept. I actually found Egoscue about 8 years ago, and I went and got certified a few times, and I do this for other people. But I had a history of some neck issues, some back issues, my knees were hurting. I had all of these problems that were going on for me about 13 years ago actually, and I couldn't find anybody to help. I went to one doctor for my knees, I went to another doctor for my neck, I went to another doctor for my back pain. I was very, very active. I was skiing professionally and doing multi-sports and working out in the gym, and the more I worked out, the worse it got. So I started bargaining with God, like, okay, if I could just get help for my neck, which was the worst part, really serious neck and disc issues, to where I couldn't ride my bicycle anymore, and that was not acceptable to me. So I thought, okay, if I could just get rid of the neck pain, I could live with the knee pain and the hip pain and the back pain. Actually, after a lifetime of athletics, I was told you only get to move your knee so many times. So I was believing that. One of the first things I learned in the Egoscue method is that the body works as a unit. The knee pain actually went away first. The neck pain's taken a little bit longer. And so I turned to Deb to ask for a little bit of help. I could feel my posture deviations. I knew what was going on. I'm very, very kinesthetic. So I'm very aware of how I walk and move and what doesn't move. But sometimes it's hard to see the forest for the trees. So I've never met Deb, though. I've sat in on her webinar classes and telephone classes. She's one of the teachers and trainers in the Egoscue method, and I follow her blog religiously, and I recommend that you do too. I ask all my clients to subscribe to her blog. It's absolutely fantastic. So I send my photos off to Deb, and she shoots me back a menu. You get to pick how much time you want to put into your menu, and I wanted the max out of her and the max out of me, so I just said the sky's the limit. I have 21 E sizes. But because I know all these E sizes, again, and my body is used to some of the movements and the benefits of that, you know, I just read that menu and I started feeling better. It was that good. I love doing it because she wasn't able to see me in person or palpate some of my hip bones. She had a whole page of modifications, which were very nice. I didn't need them, but it was super cool. It's a long menu, so she included 2 short mini menus within that long menu. And what I love the most about it was, actually what I love the most about it was it's working really great, and my neck is, that last residual of stiffness is fading away really fast. What's extra strange is that although Tower is not in my menu, I own several. I use them for myself and my clients. I did Tower last night. For some reason, for the first time in all these years, my feet didn't supinate as much. I'm like, wow, this is great. But the greatest thing, being this quasi-professional that I am too in this technique, corrective posture therapy and alignment, posture alignment, was her really, really excellent posture analysis. She called my attention to all the little nuances that are really important. Like I said, that I could feel. It's hard to look at yourself when you're standing in your underwear and you're going, oh my God, that's the worst picture anyways. Get over it. Deb, thank you so much. It's a great menu. I love it. You nailed it. And for those of you that are considering getting involved in this kind of therapy, you have to do it. This is the owner's manual that we never got for the human body. So good luck. Take care. Look me up if you're in Tucson.